Hi, this is Travis Pearson doing my journal video for MM668 for the week 6 assignment. This week I got to experience my first lady that was pregnant. She was on Adderall at the time, and during the assessment, she said to us that she had talked to her OBGYN and they had no problem continuing the Adderall XL extended release 20 milligrams for this patient to help with her ADHD. She says she's a little older now. She's like 33. Her plan is to kind of wean off this. So our plan is to start weaning the patient off Adderall because she's able to do more stuff. She's getting better help around her home from her husband and her family, and things are going really good for her. This was just my first experience with a pregnant patient, with her being 9 weeks pregnant. So we looked up the medications in the Stalls book, and it basically it didn't say yes, it didn't say no, but it said, proceed with caution, basically. But everything basically, if you don't know, you probably quit the medication. But it was interesting that her OBGYN told her that it was okay to stay on the stimulant. So we got a release of information, sent that over to her OBGYN to double check and verify, because when you start treating a pregnant patient with medications, you need to be on like high alert, because there's just a lot of complications. We're really worried about the mother and the baby. So this was definitely a new situation. Her anxiety and depression were well controlled. She's doing very good. She was just here for ADHD and a little anxiety, but it was just my first experience with a patient having an early pregnancy. So me being a new nurse practitioner, and my practitioner, I think, has been doing it 3 or 4 years. She's like, yeah, there's just some stuff I just haven't encountered. She said she hadn't encountered this before. So there was just a lot of new information. So it's just a lot of stuff to be wary about when you're prescribing. If she was on a 2nd-generation antipsychotic, we would want to DC that right away. I mean, there's a lot of medications out there we use in psych that are non-baby friendly. So it was just an interesting case. I guess maybe as a good mental note, you would want to check with your patients and make sure they're not pregnant or they're using birth control before you assign some of these medications to them. And it was just I'm sure most people do this, but it's just a refresher in doing that. But that's my journal for this week. I just want to say thanks, and just an interesting case. So if you guys have any questions, or you guys can reach out, this is Journal MM668 Travis Pearson. Thanks. Bye.